This is One-on-One. Listen, the whole range of discussion and confusion as to the Affordable Care Act, what it means, what it doesn't mean, but bottom line is people signed up, some other folks didn't, and there's going to be another period where people can do it again, and the gentleman who's sitting across from me knows more about this than just about anyone else. He is Dr. Joel Cantor, Distinguished Professor at Rutgers University, Center for State Health Policy. Joel, let me ask you, you're sought out by people across this country to make sense of the ACA, otherwise known as Obamacare. Let's take a look back. The number of people who signed up, disappointed, satisfied, what?
I think most folks are satisfied. You know, of course, we were all worried when the website was failing. And
or were there any problems there? I hadn't heard.
You hadn't heard?
Did that really set us behind?
It did, and it really undermined confidence of the general public in this whole thing. If they can't get that right, how can they get the rest right? But remarkably, they solved the problems quickly once they brought in the cleanup team. And
in New Jersey, the number of people?
So 300,000 or so, you know, I think we hit the mark, so to speak. We did pretty well. In Medicaid, we did very well in enrollment. In the new private plans through the marketplace, we are at least on par with the rest of the country. So.
But Joel, here's my question. What did people sign up for? Meaning, you and I were just talking right before we got on the air, and I said, yeah, it's great that so many people signed up, but I wonder how many people, when they signed up, knew exactly what they were signing up for, other than saying, I know it's better than not signing up and not having this coverage and having to pay the penalty. Go ahead.
So of course we don't know yet. It's new, right? So people are just starting to use their plans. And when they find out that their doctor's not in the plan, that might come as a shock to some. Many of the plans have narrower networks of providers. They have higher cost sharing than some of the old plans. Different benefit structures. There's a lot to navigate here.
Is there something about New Jersey and our population with respect to healthcare delivery and the plan?
Well, New Jersey is different from much of the rest of the country in a lot of ways when it comes to healthcare. So, for example, we have a lot more small practices, solo doctors, partnerships than most. That's beginning to change, but it changed more rapidly elsewhere. So, making sure your doctor's in the network is sometimes a challenge. Otherwise, we're pretty much on trend in terms of the structure, the kinds of plans that are being offered.
Is there a direct correlation between the hospital situation in the state, the number of hospitals, type of hospitals, and the Affordable Care Act and the implementation of it?
Well, there's some national trends that are occurring in New Jersey as well, of hospitals consolidating, hospital systems buying other hospitals. And that's going on here as well. They're positioning themselves for the new incentives under the Affordable Care Act, positioning themselves to negotiate good rates with insurers, positioning themselves to do better care.
But you know, the other thing that we've been a part of, together with our colleagues in public broadcasting, WNET and JTV and others, is public awareness. And we've been very fortunate that there have been some very generous, let's just say, and public-spirited foundations who have supported those efforts. Public awareness. I often wonder to what degree we in the media, not just in public broadcasting, but primarily public broadcasting, because you won't see a lot of this on the commercial side. Unless there's a screw up, they'll be there right away to talk about how healthcare.gov doesn't work, right? But here's my thing. To what degree can we truly educate the public about these massive changes going on in the healthcare world and what it means to them and what people actually need to do? Is that our job, your job, foundation? Whose is it?
Of course, it's all of our jobs. It's particularly tough in New Jersey. I don't need to tell you the media markets here being centered out of state with, you know, big media markets in New York and in Philly, and the stories in those states are slightly different than here. Newspapers being what they are these days with less readership, it's really hard.
But what would be the message? Say there was a really effective public awareness campaign. What would the message be?
Well, the message is there's coverage available for a lot of folks. There are discounts, subsidies available, that you need to pay attention to what you're buying. Working with Robert Wood Johnson Foundation, there's some polling data out that shows that people in New Jersey are less confident about their knowledge about health insurance, basic health insurance terms, than the national average. That surprised us. But when you think about it, it's perhaps due to the fact that we have more immigrants on average than the rest of the country, and the American healthcare system's unique in the world. And also lots of folks who are entering the insurance market for the first time.
Give folks a sense of the next opportunity people have to sign up for the ACA, the Affordable Care Act.
So if you're very low income, say $15,000 or less for a small family, you can sign up anytime through the Medicaid program. There's no open enrollment period for that. If you're above that level and you don't get insurance through your employer, the date to watch is November 15th.
November 15th, 2000 and?
This year, 2014. Right. Open enrollment opens again. You can go on healthcare.gov and get a plan. If something happens in your family, you lose a job, you lose insurance, a divorce, whatever, then there are opportunities to get in before then. It works really quite similarly to large employer plans where there's an annual open enrollment period, and special circumstances, there are exceptions.
And finally, for those who are watching saying, listen, I didn't have it before, I went to the emergency room, they took care of me, I don't know what the big deal is, so what's the pressure to have to sign up again? You say.
Well, you never know what's going to happen. And if everyone's vulnerable, can have a heart attack, and that can be financially ruinous. And the way health insurance is structured under Obamacare, ACA, what have you, it really covers those catastrophic events very well. There are penalties if you don't sign up for most people, and those penalties start going up.
You've been a big advocate of this plan.
Well, I don't know if I've been an advocate. I've been a critic as much as an advocate, I think.
You've said that this needs to be done because the alternative of the status quo is not acceptable. You've said that.
I have.
Why is the status quo not acceptable, Doctor?
Well, for people without good employer-sponsored health insurance, unless you had a lot of money, you were just shut out. We had a huge affordability problem in this state. And that's in part because New Jersey did some of the things that the ACA is trying to do, not allowing insurance companies to exclude people because they're sick. That drives up costs. The difference between our old system here, where the cost just rose and rose, and the new system is that there's financial help available. That draws more people in, draws more healthy people in, keeps premiums more affordable.
Dr. Joel Cantor from Rutgers, it's clear why people come to you to ask these important questions about the issue of our time. Thank you so much, Joel.
Thanks.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the New Jersey Education Association, Wells Fargo, Health Republic Insurance of New Jersey, QualCare Inc., Virtua, Adler Aphasia Center, and by Cone Resnick. Promotional support provided by the Star Ledger, powering NJ.com, and by Commerce Magazine. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.